Hi, folks. I'm your host, Rich Lucy, and welcome to Prevention Profiles Take 5, DEA's podcast for professionals working to prevent drug use and misuse among college students. This is such a special episode, especially for me as your host. Every once in a while, you get interviews that are considered gets, and this is one of those interviews. I get to interview the administrator of the Drug Enforcement Administration, Terry Cole. So let me tell you a little bit about Administrator Cole before we get into our interview. Terrance Terry Cole was sworn in as Administrator of the Drug Enforcement Administration on July 23, 2025, following his confirmation by the United States Senate. A veteran law enforcement leader with more than 31 years of public service, Administrator Cole began his DEA career as a special agent and rose through the ranks over 2 decades, serving at a range of domestic and international assignments, including Oklahoma, New York, Dallas, Washington, D.C., the Special Operations Division, National Security Council, Colombia, and Afghanistan. From 2023 to 2025, Administrator Cole served as Virginia's Secretary of Public Safety and Homeland Security in Governor Youngkin's cabinet, overseeing 11 state public safety agencies comprising more than 19,000 employees and managing an annual budget of $5.7 billion. Under his leadership, Virginia achieved a 59.1% reduction in overdose deaths, the largest year-over-year decrease nationwide. Administrator Cole graduated from the Rochester Institute of Technology with a BA in Criminal Justice and holds certificates in leadership from the University of Virginia and the University of Notre Dame Mendoza School of Business. Mr. Cole has also pursued continuing education at the Massachusetts Institute of Technology Sloan Executive School for Artificial Intelligence and Machine Learning. And with that, Administrator Cole, welcome to the podcast.
Well, thank you. It's great to be back and good to see you, Rich. Congratulations on your retirement. But I'm going to try to recruit you back to DEA because that's what we do here at DEA. We're always recruiting, and I'm glad we're on this college podcast because there's no greater time to be at DEA. There's no greater time to come back and be focused on protecting Americans and protecting our national security. So it's an honor to be here. So thank you.
Thank you. I mean, that's how I ended up at DEA in 2016 when Sean Ferns, my previous supervisor here, recruited me to work on this very issue, building up DEA's portfolio of resources in the prevention space. So it's been 9 months. I'm sure time has felt like it's flown by. How does it feel?
Well, it's an honor. It's an honor and privilege to be back at DEA. As you stated in my bio, I love DEA. I love the men and women of DEA. I love our mission. I was very fortunate to serve under great leadership my entire career at DEA and to come back and be only the 3rd special agent ever confirmed by the U.S. Senate to lead DEA. I'm humbled. I'm honored. Each day I come to work, you know, when you walk into DEA headquarters and you see the faces of fentanyl, you are driven every single day to honor their legacy and really push our message forward when it comes to educational, when it comes to prevention. But most importantly, we're an enforcement agency, and we needed to get back to enforcement. That's what DEA does, amazing work all over the globe with our enforcement operations.
I got to tell you, this is my first time back since I retired at the end of January, and I came in through the security entrance. And I mean, obviously I was here for all that time. The Faces of Fentanyl exhibit was here. And when you see it every day, you don't become numb to it, but it's a little bit of background unless you're actually working the wall or the exhibit. Today, when I came through that hallway, it's the first thing you see. And I know that that's partly intentional for all of our visitors here, that this is why we're doing the work that we do. And fentanyl, as we'll get into it, I've been in the prevention space 30 plus years. It's unlike anything we've ever seen in the drug landscape. But before we get into that specifically a little bit broader, what is your vision for DEA and maybe more specifically the prevention side of it?
Yeah, so when I took the oath of office, it was real clear that we needed to get back to global enforcement and specifically targeting the Mexican cartels, Sinaloa and CJ&G, that have sent so much poison to our nation and affected so many lives. And with enforcement, there's the different levels that you get to. Attacking the precursor chemicals, attacking the money movements, building capacity with our international partners, and being great partners domestically. And part of that great partnership is getting out into the community. Mm-hmm. Part of that great partnership is working with faith-based organizations, working with the state and local SROs, the school resource officers that have this daily interaction, very special interaction with the kids, but also branching out and educating the public as to the threats, as to this poison that is coming into the United States. Because as our slogan states, one pill can kill. Mm-hmm. And the more education you provide to mothers, the more education you provide to family members, to local law enforcement that might not see the big scale that we see, right, that might not understand how the narco traffickers, these designated terrorists, are disguising pills to look like legitimate pharmaceuticals. It's really something that we need to be on the front foot on, a basketball term, because we are the subject matter experts. Right. We are the best at what we do at DEA. I take great pleasure in saying that because we have 10,000 employees at DEA that come to work every single day for one mission, and that is to protect Americans. That is to protect and defend our national security. And there's many layers that you can pull back. But what I am most proud of, especially today, when I walked into DEA headquarters and I walked past the faces of fentanyl, I was greeted by grieving mothers that were at the wall today. Mm-hmm. Today just happened to be a day where the drugs are. Sarah Carter was here, and we were talking about these issues, and we went together downstairs to meet these mothers, to talk about their sons that thought they were taking a legitimate pharmaceutical, but it was counterfeit. And it poisoned their sons, and they both died at a very young age, unfortunately.
Yeah, it's, I know I'll get into this a little bit with you, actually. It's a nice segue into our next question, which is about probably the highest profile initiative right now here at DEA. It launched actually just a couple of months or so before I left, Fentanyl Free America, which is under your leadership. And it does center around the fentanyl crisis here in the United States. So what's the primary message that you want to convey with this initiative, and really what role might colleges and universities play in it?
Well, it's an important role that we all have. We're all bound by duty, number one. But number two, I think if you think back when you started my bio, towards the end of it, you talked about my work in Virginia. Yeah. And I didn't know Governor Youngkin when he asked me to join his cabinet. We had met a few times, but talking about the border, talking about Mexico, talking about China. And one day he asked me, would you join my cabinet? And I said, absolutely. And he said, I have one request of you, to bring down the fentanyl deaths in Virginia. At the time, when I joined the cabinet, we were losing 5 Virginians a day. And I conveyed to the governor, who is probably one of the finest leaders I've ever worked for, I said, I need to bring my team with me. And I brought all DEA people. They retired from government service and came to join us in the Commonwealth, and we went to work. We went to work with a holistic approach that it took. Law enforcement is a component that plays a key critical role, but so does the educational piece. So does the Department of Labor piece. So does the Department of Commerce piece. So does the Department of Veterans Affairs, where we all have to sync up for one common purpose: to save lives, to educate, to have this open and transparent dialogue about what the true threats are, not only to our nation, but that face our kids every single day, whether they're middle school kids, because that's how these gangs, that's how these cartels are trying to grab our kids at an early age of addiction. You know, whether that's vape pens that have high concentrations of THC, whether that's pain medication that they're getting through their normal chains, or they're getting them from their friends, or they're the counterfeit pills that come in. This is the educational process we need to provide to those kids. But most importantly, the biggest step I took when I first took that role for the governor was to call 2 fentanyl moms a day to understand what had happened. To educate myself, coming from DEA and enforcement side, with my years in Colombia, with my years in Mexico, with my years in Afghanistan, to take that enforcement piece edge, just to pull it back just a little bit, to understand the true shape, scope, and depth of the problem we had in the Commonwealth. And to this day, I still talk to those fentanyl moms every single day. So when I walk into DEA headquarters and I see those moms downstairs, I take the time, employees at DEA take the time to have these discussions. We welcome them here at DEA. This is their, I'm not going to say safe space, but this is their place where they can come and celebrate, whether it's a birthday, whether it's a milestone after the Senate does something with the HALT Act. It's a place that they can come, and we are going to honor those fallen every single day when we come to work.
I know on college campuses, when I was doing presentations and still do presentations talking about the fentanyl issue, college students, when we talk about prescription drug misuse, the class of prescription drugs that are typically being misused are stimulants. And some college students are under this misguided belief that it's going to help me get a better grade if I, pop, an Addy. And, I keep getting the word out and the message out. There's no research to show that that's true. Obviously, if you are legitimately prescribed to help with ADHD, certainly helps with your concentration and your focus. But we're talking about misuse. We're talking about non-medical use. And we have students out there who are getting these through not legitimate means. They're getting it from a teammate who knows a friend who knows a friend who knows a friend who knows somebody. And that pill makes its way back to Johnny. And next thing you know, Johnny's a statistic. And, I've done these presentations where I've said, look, on the job description under other duties as assigned, never did I think one of those duties would be talking to a mom and or dad who lost their son or daughter. We were just coming out of the pandemic, and Sean had asked me to do a virtual call with this mom. She lost her son, and talk about what DEA has in terms of resources. And I remember it was early November 2021, and it was the first, you always go through those years of firsts, right? It was her first Thanksgiving without her son. We were both bawling by the time that the call got done, but I know she was so appreciative of just having somebody from DEA to talk to and to hear the story. And that just it never gets easier. I mean, every story is different, but like you had said early on, you have students, and it's not just college students. It's happening in middle school. I called fentanyl the equal opportunity destroyer. It doesn't matter.
That's right.
Race, ethnicity, socioeconomic status, rural, urban. It just does not matter. And it's funny you mentioned Governor Youngkin talking to you about the previous times you talked to him about the border and such, and people who are further away from the border think that, well, it's down there, and they don't realize that what's happening is and we have maps, those graphics to show the cartel's influence all the way up to the Canadian border. So it's not just the southern border; it's everywhere.
It's everywhere, and we're surrounded by the cartels. Cartels have significant influence not only in the U.S., but now in Canada. And I think that when we look at the broader picture, that's why these educational opportunities are so important. Just a few weeks ago, I sent letters to basically all the Division I, Division II, and Division III coaches, inviting them to DEA headquarters when they're in town for spring break. Come to our museum. I will host you in the auditorium. I will personally appear to talk to your teams. And we had our first lacrosse team come in from a very well-to-do part of the country, very prestigious college, and there was 60 players and coaches. And the first thing I asked them was, how many of you have been affected by fentanyl? Lost a loved one, know somebody who passed from a poisoning. And Rich, every single member, all 60, raised their hand. That is the impact that we're talking about with this fentanyl, epidemic, this weapon of mass destruction that has caused chaos in the United States. And that's why I'm still begging, I look into the camera, any middle school, high school, college, university that is in town that wants to visit DEA, please come see us. We would love to show you our museum, number one, but we would love to have a conversation with you, meet you in the middle, so to speak, halfway, and provide you different avenues for resources, whether it's our website at DEA.gov, Fentanyl Free America, DEA.gov, National Take Back is this weekend, DEA Red Ribbon talking about Kiki Camarena. There are more resources to start the dialogue between parents and their kids, coaches and players, or administrators that are interested in learning more of what they can do. And we want to be a key piece of what they can do.
Yeah. When you mentioned the lacrosse team coming in, I thought you were going to go in a different direction, which it's interesting. I want to bring it back. I've been in this work for a really long time, and there are certainly schools, neighborhoods, K-12, college, who think that the drug issue, it just isn't here.
Yeah.
It doesn't affect us. We're above that, and that's why I say no, it's not. It is everywhere.
Yeah.
And it doesn't matter, how prestigious the school or the neighborhood or whatever. And to have 60 hands go up is, I think, that's proof of that. People are so connected to this, unfortunate connections.
That's right. And it knows no boundaries. Right?
Yeah.
It doesn't matter where. They are basically profiteering on our suffering. And that's why we need to put people over profit in everything we do. And that's one of the great things about DEA is we are back to doing our job. We are back to enforcement. We are back to education. We are back to supporting, preventing, all the key pillars under Fentanyl Free America that have been building blocks over years that we have learned from really the parents, the people that are in need of help. But it's about immobilizing as many people as possible. It's about educating as many people as possible. It's about bringing them into the fold to be part of the solution. And there's more parents that want to join. There's more parents that want to help us in what we could do better, especially on the prevention, education, and support piece. And we're open to that.
Yeah.
And that's really important to me.
So over the last decade, DEA has really built up its portfolio of resources around preventing drug use among college students. It's no secret to our viewers. I helped lead that, in our time here. It's been a lot of my background. From your perspective, why is it so important to zero in on focus on colleges and universities?
Well, I think we've been talking about it here from the start. Number one, they're our future leaders, but they're also, I consider, potential customers. And potential customers to counterfeit poison that's coming across the border. They might think it's a Xanax, they might think it's an Adderall, they might think it's an Oxy or whatever the case may be, but it's really a synthetic opioid poison that's being manufactured by the Mexican cartels through precursors that are coming in from India and China for the axis of evil, purely to profit on this addiction, profit on this potential deadly dosage. It only takes 2 milligrams, as we know, to be deadly. And I think that the more educational things we can do, the more people we can bring into the fold, the more people we can educate, because a lot of those kids, a lot of those college students, they're also active in their communities. They're also coaching sports. They're also participating in government affairs, and they're going overseas for foreign events, and they can represent the goodness. They can spread the word to help save a life. And that's what's really important. And that's why these campaigns that we have at DEA, and they are multi-layered campaigns that focus on the prevention piece, that focus on the education piece. I also look at it as building capacity for our next set of warriors that are willing to go out and be different and save lives and to push the message forward. And for that, they can go to DEA.gov careers and come join our DEA team. I'm always recruiting.
There you go.
It doesn't matter what audience that we're talking to. There's no better time to come back and serve than right now at DEA. Yeah. Across all core series, we are hiring, we are the subject matter experts, and we are the best federal law enforcement agency around, and we have been for many years.
So we talked a little bit about Fentanyl Free America, how high profile that is. There's another high profile initiative coming up later this year, Red Ribbon Week.
Yeah.
And we know it was born out of a tragedy. I'd like you to talk a little bit about that. And how can colleges, universities get involved in Red Ribbon Week activities?
Yeah, especially with Kiki Camarena, so special to the DEA global enterprise. We will never forget Kiki or any of our fallen, number one. Number two, if you cause harm to our employees, we will follow you, we will hunt you down, and we will bring you to justice. And there is no greater example of that than RCQ, Rafael Caro Quintero, who's sitting in prison right now in New York awaiting trial on narco trafficking charges.
Was that last year?
That was last year.
Which was the 40-year anniversary. It's hard to believe it's been 40 years since Kiki's death.
It's hard to believe, but it still stands in the forefront of my mind every single day when I come to DEA. The health and safety of every single one of our employees is number one priority. And that word needs to be spread, that our employees are valuable, that our employees will always be remembered. Right around the wall upstairs from the Faces of Fentanyl is a DEA memorial. Yeah. And we are more than ever committed to remembering every single employee in pursuing those that cause harm to our employees. That is my commitment. That is my charge. And we will continue to be one of the best at pursuing those that harm our employees. So with Red Ribbon specifically, what an amazing time to get out and not only remember Kiki, but to get the word out regarding drug-free communities. Yeah. And as we've seen this grow, it's just absolutely amazing. There are so many different avenues that this has taken us to, and so many opportunities for people to jump in and volunteer their time for one day to remember. But we want to keep that thought in everybody's mind every single day, because one pill can kill you. And that's why it's so important that we just not celebrate Kiki, we celebrate drug-free communities, but we're also doing a lot of prevention. So how can the universities get involved? This is no better time than to hold a community event, to hold a campus event, and to make it a fentanyl-free America in your community afterwards, to make it drug-free Red Ribbon in your community afterwards. And I think it's showing that evil that we're not going to stand for it. And we're going to continue to protect our citizens.
It's an ideal opportunity, you mentioned it just now, for colleges to collaborate with their local communities, host a town hall meeting, peer educators working on college campuses. Certainly, we know students listen to other students, and so getting the word out that way. You mentioned how important the employees are to you, and I did pass the Wall of Honor as I walked in today, and I know the memorial service is coming up in the next couple 3 weeks, each May. Wow, what a emotional event that is. I know my first one as a DEA employee was in 2016. I had just come on board a month before. Not a dry eye in the house. No. That's how much it means to people, and to hear the roll call of the 80+ men and women who have lost their lives. I know how much it means to the people working here, because I was part of it. And I think that goes back to what we were saying earlier when we are out talking to the public, moms, dads, students, whether they're in K-12, college, whether they're in the workplace. The DEA's here for you. This is, what we do,
Yeah, we have more families that come back every year for the memorial service.
Yeah.
And it's really important to all the employees. It's important to me. It's important to leadership. I'm going to start my day, the Memorial Day down at Quantico with all our bats. They like picking on the old guy in the gym, which is fine.
But you're in there.
But I'm in there. And then after that, we're going to go over to Arlington National Cemetery and visit our FAST members that are laid to rest in Arlington Cemetery. And
there
then
was just a memorial service specifically about that last year, right?
Yeah. It was in the making for years.
Yeah.
And just took a little push once I got in. The team had everything ready to go, and it was really important to me after serving in Afghanistan, after knowing those fallen warriors, and I wanted to ensure that we remember them. This year, we're putting together another memorial for SNOCAP employees that we lost during SNOCAP. It's critically important that we remember where we came from, we remember our legacy, and that nobody is left behind. So that day is going to be, like you said, there's not going to be a dry eye in the house. And all the leadership returns. We're looking forward to hosting everybody. We're not going to put them through the same security that you went through trying to get into the building. We're going to be
like TSA.
We're going to be a little bit
TSA without pre-check. Let me just tell you.
We're going to be a little kinder to everybody coming back, but it is a special day, and it's a time of remembrance. It's a time to really honor the families that still come back year after year, and with our amazing black and gold. Guaranteed there won't be a dry eye in the house.
So as we wrap up, I always like to end these interviews. I call it the advice and guidance question. What advice do you have for our viewers, the folks who are working on campus or around campus, and also advice for the students themselves? We know there are plenty of college students. I've learned of faculty members, the podcast is required viewing. And they do an assignment around it. I find that fascinating. But for the professionals, the students that are watching this podcast, what advice do you have for them in this whole prevention space?
Yeah, I would love for them to visit our website. Start there and go to DEA.gov and look at Fentanyl Free America or One Pill Can Kill or, the different initiatives that we have. And then look at what we're seeing globally and have those discussions with your peers. Have those discussions that drive more discussions, that educate as many individuals as we can, because that one conversation is going to save somebody's life. And it's key critical that we give them the resources, right? My youngest daughter is information driven. So I think the more information we can give them, the better off we are. And I'd also, while they're in there looking at all these other great pillars of support and opportunities to have that discussion, to bridge those difficult discussions, also look at DEA.gov careers and see if service in making a direct, immediate impact, long-term impact in our communities through any one of our core series fits them. Anything we can do to drive people to our website, I am guaranteed they'll be very, very happy with what they see when it comes to information that is out there, but opportunities as well at DEA.
In the prevention space, we always say to folks, everybody can play a role. And I think that I'm hearing that. And what you're saying, that whoever visits the website, you can see yourself somewhere in the work that we do, whether it's diversion, enforcement, prevention, what have you.
And some of them are already doing it.
Yeah.
Whether they're an RA, or they're involved with campus safety, they're involved with the blue lights where they give escorts on campus for safe passages, they're already doing it. And they might really enjoy it. So this might be an opportunity.
Yeah, absolutely. Well, Administrator Cole, this has been an absolute pleasure. In prevention, we talk about passion, having the passion for prevention. I see it in you. I see in the work that you do every day. I mean, I first met you 10 years ago when I came on board. You were the executive assistant in operations, I believe. And that's when I first met you, but I can see how important this work is to you all across the spectrum of the work DEA does.
Well, thank you. I love being back at DEA. It's nonstop. You know, it's 14, 16 hours a day, but we have an amazing staff, amazing team, driven employees, and what an opportunity to come back and serve about Americans first and America first.
Yeah.
Tremendous opportunity in drug federal law enforcement to be involved with our global enterprise. So thank you for coming back for this. You're welcome anytime. I was trying to recruit him before the show. I'll keep the pressure on, but it's great seeing you again. Congratulations.
Sir, thank you so
Yeah.
much. And to our viewers, thank you for joining us for this very special episode of Prevention Profiles Take 5. Be sure to check out all of the previous episodes on DEA's website for campus professionals, which is campusdrugprevention.gov. With that, I'm going to say have a great day.